Hi, I'm Alex, but many call me Dr. Mama Bird. I'm a wife, a mom, a chiropractor, and maternal health care advocate. After a traumatic birth experience that led to an unplanned C-section over 6 years ago, I found myself searching for answers on how to heal. Even though I was in the maternal health care space myself, I found it difficult to find the resources needed to truly recover and restore my body. After 2 years of research, I found myself pregnant with our second child and was able to have an amazing redemptive VBAC birth experience with my dream team. After that incredible experience, I felt God had placed on my heart a mission to help other mamas and families have a similar redemptive experience. And in time, with my husband's help, we developed the C-section restoration method. On this journey, we've met a ton of amazing healthcare providers that are often considered hidden gems in the Dallas area. Now, as a part of that mission, I'm here to connect you and other families with the incredible healthcare providers who are passionate about supporting you and helping you to achieve your family's health and wellness goals. I'm Dr. Alex Pankoch, and this is the Dr. Mama Bird Show. Alrighty, welcome back, Mama Birds. It's Dr. Alex here today, and we have an incredible show planned for you. Today, we're going to be interviewing another mom who is also an amazing entrepreneur who is passionate about women and women's health. Without further ado, it's Dr. Becky Allen from Genesis PT and Wellness here in the DFW area with 7 locations. And today, we're going to be talking about pelvic floor health. What is it, and how do we support ourselves throughout our lifespan, not just when we're pregnant or postpartum, but in general. So without further ado, let's introduce Dr. Becky. I would love to know a little bit more about you. Obviously, we know you're a mom, you're a wife, you're an amazing entrepreneur. Tell us more.
Okay, well, thanks so much for having me, Alex. Like she said, my name is Dr. Becky Allen, and I am a mom, I am a business owner, and I am a pelvic floor physical therapist. And I own Genesis PT and Wellness. We have 7 clinics across the Metroplex, and I kind of just run around operating them as they go. I have an awesome team that makes up each of the locations, and great therapists doing their hard work.
Awesome. I love to start the show getting to know a little bit more about your passion. How did you decide to become a physical therapist? And then specifically, how did you get into pelvic floor PT?
Yes. So when we think about how I became a physical therapist, or how I decided to become a physical therapist, in college, doing my undergrad, I had no idea what I wanted to do. I thought I was maybe going to be a teacher, coach volleyball. I played volleyball throughout college, throughout, my childhood and teens and all that. So I was like, I'll just do that. I'm going to coach volleyball and teach. And I grew up from a family of teachers, so why not? Yeah. And that was my plan. And then I got injured playing volleyball. I hurt my back pretty bad, and went to PT for it. And I was thinking to myself, this is really cool, and this is really helping me, and it's getting me back on my feet, and was very meaningful to me. And on top of that, the place I went, the people were just like medical providers like I had never met, right? You think of sterile doctors' offices, and you're just like, oh, doctors, oh my gosh. But then I had gone to my first bout of physical therapy, and I was like, these people talk to me, they laugh, they listen to me, they help me feel better. They don't just prescribe something that I'm just gonna be like, what is this? So I had my life kind of changed by physical therapy. And so that's how I decided to go into the field of PT. Graduated college in 2012, graduated PT school in 2016, class of Sweet 16, TW, whoop, go Pioneers. And from there, I started off in the same setting that I had gotten used to as a patient, which is called outpatient orthopedics. And so that's just your run-of-the-mill kind of back pain, post-surgical, my neck hurts, I tore my knee or whatever. And that's what I was doing. And then once I became a mom, which was about a little less than a year into my official career, took my maternity leave, and I kind of decided after that that I was going to pull back from how much I was working and just take an extended maternity leave until I figured out what work was going to look like for me. And I knew I loved PT, and I knew I loved helping people. I just didn't quite know, where am I going to fit? Where am I, and what's it going to look like? So took my extended maternity leave. I kind of kept my feet wet and worked in a nursing home, in a hospital, just, a couple times a month to do something outside of the home. Honestly, get away from my lovely children for a little bit. So that kind of kept my foot in the door. And it was actually my midwife for my second baby, I have 2 kiddos, who kind of put the little birdie in my ear about pelvic floor PT. Yeah. And I was like, lady, what? Like, you want me to do what? Because it's funny, in PT school, you don't learn pelvic floor. You learn that there are pelvic floor PTs out there. And the joke in our class was they go in your rectum and they do rectal work. And I was like, what? I'm not going to ever do that, at the time. And so, it was just funny because she put the birdie in my ear and just kind of kept nagging me throughout my second pregnancy and into postpartum, and was finally like, Becky, I am starting a wellness center and I have a lactation consultant lined up. I have a chiropractor lined up. I am getting a massage therapist and I need a pelvic floor PT, and I know you're a PT and I know I like you.
Yeah.
And so let's do this. And so that was kind of the long story of it, of just, I was like, well, I guess I'll look into it. I'll see what it's like. And the rest was history. I absolutely loved my first course I took. I was sold, and yeah, here I am. That was 4.5 years ago.
That's awesome. That's such a great story. Most of the people on here, all of the people that have been on here so far, have a very similar story where their life was changed by the profession that they now are serving in. And so I love that you shared that. It's just like one step, and it's always a progression, right? Like, you never know where you're going to end. I started out pre-PT actually, and here I am, not a physical therapist, but loving hanging out with PTs. And so all that said, I'm curious, well, I know, but I think maybe some of our audience may not know, what is the pelvic floor and what exactly is pelvic floor PT?
Oh, yes. Love this question, of course. So the pelvic floor, we'll start there. First of all, everyone has one. A lot of people think, oh, it's just like a woman thing or a mom thing or a postpartum thing even, but everyone has a pelvic floor because everyone has a pelvis, right? It's the center of our body. It's where all load is transferred through it. We have to use it for literally everything we do: walk, sit, run, jump, breathe, all of it. The pelvis is involved. And so the pelvic floor is kind of the bottom of the bony part of our pelvis. It's muscles, ligaments, fascia, tendons, things like that kind of make up this sling or this hammock, if you want to picture it, kind of like a hammock. And it sits at the bottom of our pelvis and it supports everything on top of it. So our pelvic organs sit on it, like our bladder, our uterus, our rectum. If you're a guy, your prostate's in there. And then on top of that's your abdominal organs. And of course we get up to the chest and your head, and all the weight of everything sits on the pelvic floor muscles. And so it plays a role in that support. And it also, because it attaches to the bony part of our pelvis, it plays a really big role in stability of the bony pelvis. So pregnant moms, I'm looking at you when you're having that round ligament pain, SI joint pain. A lot of times we're seeing asymmetries of the sides of the pelvic floor muscles. And so it's a really big deal in stability and load transfer as we walk, move a leg to get out of the car, all of that stuff. Then of course it has sexual function. That's how we get pregnant. And it has birth function. That's how things come out like babies. And then of course pee, poop, all that good stuff. Things go in, things come out. And then it even has what's called a sump pump function, which is one that a lot of people don't really think about too much, but because the pelvic floor works so much with our abdominals and how we breathe and our diaphragm muscle, every time we breathe, our pelvic floor is moving a little bit up and down with our diaphragm muscle. And because of that, it's helping all of the fluid, which is like in our veins and everything in our arteries. It's helping the veins move the tissue back up, and our lymphatic vessels move the tissue back up. And so it's really important in that. So if we have a really stiff pelvic floor, it's not moving well, a lot of times that fluid can get kind of stagnant, and then we can get things like pelvic pain, abdominal pain, pelvic heaviness, things like that. So that's the pelvic floor. It does a lot. Very important. And then pelvic floor physical therapy is a specialty within the field of physical therapy where we have extra training, certification of the pelvis and the pelvic floor muscles. So we already were a PT, and then we had our licensure, and then we moved on and got more education on the actual pelvis and pelvic floor and how it works with literally every single thing we do all day long.
Yes, it's so interconnected. I think sometimes, and you'll be able to speak more to this, is it's not just the pelvic floor that pelvic floor PTs work on. From a chiropractic standpoint, and you probably see this in your practice a lot too, we are always wanting to, I love to combine the two. I say chiropractic and pelvic floor PT are like peanut butter and jelly, because if your pelvic floor is not functioning properly, your neck's not functioning properly.
Yes.
But if you've got shoulder pain, jaw pain, and neck pain, I'm like, I wonder what your pelvic floor is doing. I wonder what your feet are doing. I wonder what's going on. And so share with us a little bit more about how it's like literally not just this area, and what can that look like, and from a clinical perspective for someone who's like, okay, so how do you treat my pelvic floor?
Oh, yes. Okay. So like I mentioned a minute ago, pelvic floor PTs specialize in education about the pelvis and about the pelvic floor. But what really makes us good at what we do is it's not that we just look at the pelvic floor muscles or treat the pelvis and the pelvic floor muscles. We actually understand how the pelvic floor is usually, I call it the victim. Usually when we're having pelvic floor issues like leaking, painful intercourse, chronic constipation, hip pain, low back pain, heaviness, pressure, prolapse, I could go on all day. When we're having those symptoms in the pelvic floor, it's not usually the pelvic floor's fault. There's a small percentage of times where it actually is, like you could have a really bad muscle tear in birth, like the levator ani muscle actually comes off of the bone. Okay, we have an injured pelvic floor. The pelvic floor is the problem. Most of the other times, though, the dysfunction we're seeing there is due to something else, somewhere else in your body or emotionally or your gut. There's always, 99% of the time, an outside cause. And so while we're specialized in the pelvic floor, where it actually benefits you is we are PTs who started off treating the whole body. And so we know that how the foot moves, like you were saying, how the foot moves is going to impact everything up the chain, up the leg, which guess what's attached to your hip? It's your pelvic floor muscles. And so looking at really how the entire body or the entire human really in front of you, not just their body and skeleton, but their nervous system, their emotions, are they super stressed? Do they work a stressful job? Are they a single mom and they're doing literally everything at all times and never have a break? Do they have gut issues? All of that is kind of what makes you super great at being a pelvic PT, is when you really know how to zoom out of the pelvis and get curious really, and look at what the heck is causing this leaking? Because I know it's not just that the pelvic floor is weak, is what usually people think. So.
Yeah. Speaking of the pelvic floor being weak, now a lot of times when I ask a patient, have you done any pelvic floor work? Have you worked with a pelvic floor PT? They usually will say, yeah, I do Kegels every day, or I did Kegels for a couple of weeks. And that's usually an answer there. I'm like, okay, you didn't necessarily do a whole lot of pelvic floor PT. What are Kegels, and why are they not like the best prescribe all exercise?
Yeah. I will die on this hill. This is my favorite topic, honestly, to talk about. I've built my practice on this topic, on just going beyond Kegels, because what a Kegel is if you think back to the sling of muscles that I talked about at the beginning, which is at the bottom of our pelvis, it's supporting everything above it. That sling of muscles, because it's a muscle, like our bicep muscle, right? It can contract and shorten, and it can relax and lengthen. A Kegel is when the muscles squeeze and lift. That's it. It doesn't even include when they let go. It's literally just talking about the muscle going, squeezing and lifting and just being there tight. And so there's this whole thing where probably dozens and dozens of years ago, that's really all we knew about women's health, right? We're still really behind on women's health, but that's really all people knew was, oh, well, you're leaking, just squeeze it, right? Just make it tighter, right? Or whatever. You're having sexual dysfunction, just tighten her up. And so just squeeze. And so that's where the premise of Kegel exercises came, was that's all they knew. The good thing is now we're 50, 75 years past a lot of that initial research. Unfortunately, people still hold on to that a lot. And so that's all they still know. What I'm out here in the world trying to do is educate patients, providers, clinicians alike, that there's way more to the pelvic floor. The pelvic floor muscle should never just squeeze and lift. No muscle in our body should just go. Right? Like imagine, you have neck pain, just squeeze your neck muscles, right? Yeah. And just never let them go. And it's just not how the pelvic floor works. Yeah. It works with how we breathe, like I was saying earlier. It works from a side-to-side perspective as we walk, as one side of the pelvis does one thing, the other side rotates the other way. that means both sides of your pelvic floor do something different at each step that we take. And so if we're constantly thinking squeeze, 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 it can't do that. And if you also think about it, a muscle gets tired. If you're just clenching and holding, it gets tired, and then you go to sneeze and it can't do its job.
Yeah.
It can't hold the pee in because it's tired and it's tight and it's short.
Yeah.
And so it cannot be the treatment for pelvic floor dysfunction because it's incomplete. It's just not how our body works. There's a place to learn how to do it. I love people getting to know their body and getting to feel how their pelvic floor can lift and squeeze and feel how it can relax and lengthen. That's great. We all need to be able to feel our bodies and feel kind of how they work. And then let's move on.
Yes.
Then let's move to function.
Yes. I love that you share that. And, my first introduction to pelvic floor PT was from my own experiences after having a C-section, and that just radically changes. We're going to have a whole episode on that another time, but radically changes how your body functions, including your pelvic floor, and, trying to figure things out for myself, and then finally getting to see a pelvic floor PT and realizing that literally uptight is my personality. And that being uptight, whether it's your pelvic floor, your personality, your shoulder, your jaw, all those different things, actually Kegels can make worse and are not something that should be prescribed across the board. It sounds like even at all, without something else that goes along with it. And so I think that I love that you're sharing that message because it is so complex. Even just last year, I broke my foot and my pelvic floor was doing great. And then all of a sudden things came back because it's so interconnected. And that was another opportunity to continue to learn and grow. As a clinician as well, most of us experiment on ourselves. If anybody's ever watching this and you're a clinician, you're like, is it weird that I try all the things first before I do them? No. We all do that.
Yeah.
But it is definitely something that I love that you share that perspective and that it's something you're so passionate about because it does make a huge difference when working with someone who comes into my office anyways and they're dealing with whether it's back pain, SI pain, or headaches or anything. If they understand that it's all connected and how it's all connected, and if we can work with a PT who is looking at it from that perspective of it's not just right here, the problem, we need to see what else is going on. We're looking at things holistically, and that's really what holistic healthcare is looking at the whole system, the whole body. How does it all work together? It doesn't necessarily mean like what a lot of people think holistic can mean. There's so many different ideas around holistic, but it just means looking at you as a whole. And I love that you provide that perspective to patients as well as other providers as you teach. Speaking of which, you teach other providers. I'd love to hear a little bit more about that.
Yes. So outside of my clinical practice and seeing patients, which I don't see that many right now just because we've grown so much, but outside of that and running the clinic, I coach other providers, whether they're a PT, an OT, a trainer, chiropractors, on a few things. I teach them on clinical side of things, which is basically how the pelvic floor works and how the body works with it and how they can use that information to help their patients and their clients. And then I also teach business skills and leadership skills to the same population, on how to grow teams and how to grow their practices and how to just do things differently and better. I like to think of it.
Yes. So you're still a teacher. You said I was going to go into teaching, but I didn't. You did.
True.
You are still a teacher.
That's true. I never thought about that.
That's exciting. That's awesome. And so right now you said 7 locations. You have multiple PTs on your team. Tell us about your team.
My girls. Yeah. We call ourselves the Genesistas because my practice is named Genesis. So we're Genesis, if you know what I mean.
Yeah.
We have 17 pelvic floor therapists scattered across the Metroplex, and even one who's solely virtual. She's a potty training expert who is a pelvic PT. So she has that knowledge, and then she has the pediatric development knowledge, and then she honed in on potty training. So, and she lives in Florida, but she works with us and sees patients virtually all over the world. But that's my team of clinicians. And then we also have about 5 kind of administrative supporting girlies who we could not survive without them. And we're just kind of evenly dispersed across Dallas, Fort Worth, and we're killing it.
Yes, you guys are. I see it. I see the growth. I've watched you grow since you opened. We were down the street from each other when we opened, and I was like, whoa, look at this girl take it off. She's amazing. I would love to know, just to summarize for the the person who's watching this, who's like, I think maybe I need to do something about my pelvic floor. What are some indicators, whether or not, I usually say if you're pregnant, you need screened. If you're postpartum, you need screened. But outside of some of those things, what are some indicators that somebody might say, you know what, I probably should make an appointment?
Yeah. So if you have a pelvis, you should, but really, yes. But as far as like things that you'll notice in your day-to-day or in your life, my favorite is chronic low back or SI or hip pain, kind of in that lumbosacral area. If other things aren't touching it, if you're seeing your chiropractor, maybe you've tried what I call regular PT, maybe you've done medication or injections even, you've tried the things and it's not, you're still in pain. Likely your pelvic floor is involved. And so that's one of my favorites, is to get patients in my clinic where they're just like, I just can't fully get over it. It's gotten better, but I just can't fully, there's something there. And I'm like, it's your pelvic floor. Yeah. So that's super fun. So yeah, chronic low back pain, things like that. And then symptoms might look something like heaviness, pressure in women. So people might say it feels like there's a headache in my pelvis, or it feels like things are falling out. It feels like there's something stuck in my vaginal canal. Those are all kind of signs and symptoms that could point to something called pelvic organ prolapse. It sounds horrifyingly scary. It's not if you get in, to the right provider, and it's very easy to treat. So symptoms like that, and then sexual dysfunction. So that could look like painful intercourse. That could look like inability to engage in penetrative intercourse. That could look like inability to orgasm. Anything where in, honestly, your sex life, you're like, this ain't it. Like, this is not, it either hurts or it's subpar or whatever. There very well could be a muscular component going on or a fascial component. And even if there's not, pelvic floor therapists are trained to be able to refer you out to who could actually help you if it's not muscular. And then, of course, leaking of any kind, never normal. So I don't care if you've had 6 kids and you're 75. If you leak at any time, sneeze, cough, laugh, you can't make it to the bathroom, you leak and you didn't know why you leaked or when you leaked, none of it's normal ever. And so that tells us that there's a muscle dysfunction. There just is. And it's up to us to find the cause, so don't do Kegels. Yeah. Don't do them, because it's not going to help you in the long term. Might make it worse. And yeah, at best it's a Band-Aid, to be honest. So any leaking of any kind, chronic constipation is a big one. One of the jobs of the pelvic floor is to let poop out, people. So if it's difficult, there's likely a muscle dysfunction there. And a lot of pelvic floor therapists also have what's called visceral training, which means our organs. And so we can work on the organs, which helps with digestion. And so we have a lot of tools in our toolbox outside of just the pelvic floor. And then a lot of postpartum moms might have heard of something called diastasis recti, which is a stretching or a separation of the abdominal muscles in the front. Happens to 100% of pregnant moms. It's a normal thing in pregnancy, but when it becomes problematic is when it lingers a little bit past that 6-week mark. And so moms who are like, my abs are just like a squishy or like a gap there, or maybe, I have this mommy pooch, they like to call it, something like that. Or maybe they were diagnosed with diastasis by their doctor, midwife, chiropractor, someone. We're the people that you go to. And then, of course, just C-section recovery is so important. That's a major abdominal surgery. Any other surgery in this world, you get referred to PT. Any of them. So you gotta go. So that, and then just chronic pelvic, I could just go on and on. Chronic pelvic pain, endometriosis, gut dysfunction. If you have any of that, pelvic floor therapy is where you need to go.
Yes. Awesome. Thank you so much for sharing. I think that encapsulates a lot. Now, I have one last question before we jump on. So you mentioned at the very beginning, everybody has a pelvic floor. So do guys. And I feel like what I've noticed is a lot of times they get left out. And I don't know if you treat men, but I know there are some people who treat men in the DFW area. What are some signs that a man, if you're thinking about your spouse, you're like, man, my spouse is having some issues. I'm good, but I've noticed something that maybe I might want to bring up. What are some signs there?
Absolutely, yes. So personally, I don't treat males. That's just what I choose. But I do have every single clinic location of Genesis has a male treating therapist. So we do treat males. What is most commonly seen in pelvic dysfunction in men, I'm going to go through the list, is going to be constipation and hemorrhoids. Yeah. Your man, he's on the toilet for 30 minutes with his phone and he's like, oh, I'm fine. No, he's got pelvic floor dysfunction. And so that's a really, really big one that we see is hemorrhoids and constipation and straining in men. And then we'll see, honestly, hip pain and low back pain, like I was talking about. Yeah. Men, I mean, they, it's the same with females, but a lot of men will just kind of live with it, or they'll, no, it's fine, whatever, but it's not fine. Like if it's chronic and if the normal treatment approaches aren't helping, your pelvic floor is likely involved. So that's a biggie. And then sexual dysfunction, which could include erectile dysfunction or premature ejaculation. So any sort of sexual dysfunction, lack of sensation. I mean, similar to females, like if it just ain't working, there's a pelvic floor involvement most likely. And then in the older populations, a lot of times we'll see incontinence, like urinary incontinence or urgency frequency even. And there could be underlying medical reasons as men get older, like prostate stuff. But even if there is or isn't, there's still the muscles are what's dysfunctioning. So get in to see a pelvic floor therapist.
Yes. Don't ignore it. I don't remember the exact statistic, but I think it's either a 1/3 or 2/3% of the people who are in nursing homes is due to incontinence, male and female, meaning a problem that was potentially lingering when you were younger grows into a much bigger problem that really takes away your ability to be independent and have the quality of life in the long term. So if you're in your 20s, 30s, 40s, 50s, 60s, wherever you're at, and you're like, it's not working, you can do something about it. And that's where Becky comes in, Pelvic Floor PT, Genesis, and there's tons of amazing PTs all over DFW who are more than happy, willing, and excited to help you really be able to enjoy your life across the board, not have to worry about like, oh, I gotta go to the bathroom really quick, or all the other issues that could come with that. And then I love that you shared potty training. I wish I knew you had a potty training PT a couple of years ago, because girl, we needed it.
Oh yeah, girl.
So, but yes, thank you so much for coming on. If somebody wanted to book an appointment with Genesis PT and Wellness, how would they do that?
Yes, so you can find us on our website, genesisptwellness.com, and we have a contact form on there where you can reach out. Our phone numbers are on there. You can call or text. Please follow us on Instagram. It's just at Genesis PT Wellness, and you can DM us there and book. That's fine. But you'll be dealing with an admin who will kind of either answer the phone or the call or the text, answer the email, whatever, and get you booked. And then you'll be on your way in no time.
Awesome. Well, thank you so much, Becky.
Thank you for having me. Yes, this was so fun.
Yes, awesome. All righty, Mama Birds, that's it for today's episode. I cannot wait to catch you in the next one, which will probably be my birth story. We'll see what happens at that point, but we will be back soon, and I hope you all have a blessed summer.